3 News Now this week.
Well, a dire warning this evening from the medical community in Omaha. Daily case rates, hospitalizations, and deaths in Nebraska are rising to near record levels again.
Tonight, 3 News Now reporter Ruta Olsenaida spoke exclusively with leading infectious disease experts at UNMC and Douglas County Health Director Dr. Adi Pour, and they all say we could be headed towards a very bad fall and winter. It's a story you'll only see on 3.
UNMC experts say it's time to reassess what Nebraska has been doing the last month to fight the spread of COVID-19, because whatever it is, it's not working. And Douglas County, which had been doing well for a while, has seen numbers jump.
In the last 3 weeks, for Nebraska and Douglas County, we've seen almost a doubling in the number of cases that are being diagnosed on a daily basis.
That statistic is startling when you take into account the cold autumn months ahead and individuals heading back into closed spaces, indoors.
It could be a really scary fall if we allow this to continue to trend the way it's going. And right now, to be honest, instead of applying the brake to really try and put additional measures on, we're hitting the gas pedal. And that is exactly the wrong action to be taking right now.
If we take a look at the data, Nebraska's daily new case rates are nearly back at peak levels from the spring, as are death rates and hospitalizations, which worry Dr. Lowe, Dr. Lawler, and Douglas County Health Director Dr. Adi Pour.
It does concern me very much. I'm always looking at the hospital data. That's the most worrisome.
Douglas County has a hospital occupancy rate of around 80%. And due to economic reasons, hospitals like Nebraska Medicine can't postpone elective surgeries like they did in the beginning of the pandemic, meaning space is limited.
We're very close to our highest levels of cases and hospitalizations right now. So I would definitely anticipate that we're going to see our highest levels of cases and hospitalizations in the months to come.
The answer as to what needs to happen to get trends back down isn't one-fold. Just wearing masks isn't going to fix everything, and neither is just avoiding large crowds. It's all of those things together, happening simultaneously, that's going to help us avoid major effects.
To control spread in a community, you don't need to shut down everything, and you don't need to have everybody locked up at home. There seems to be this view that we either need to be completely open or completely shut down. And the reality is you can maintain low levels of community transmission if you follow some of those common sense guidelines.
As the experts continue to watch the trends, they say action needs to happen at the individual, local, and state level to keep those case numbers down.
Hopefully, my hope would be that we actually prove every expert wrong and we don't see increases in fraud.
Reporting in Omaha, Ruta Olsenaida, 3 News Now.
Pandemic experts at UNMC are worried that Nebraska is quickly headed toward disaster as the number of COVID-19 cases continues to rise. Right now, the number of positive cases and hospitalizations match what we saw at the peak of the pandemic in May. One huge difference, though, is that instead of operating at 50% capacity, metro hospitals are operating at 85% capacity.
And the assumption that if you get sick, that we're going to have a hospital bed for you is a false assumption.
The medical experts say with flu season on the way and cases still on the rise, now is not the time to be rolling back restrictions.
Certainly, we have not yet reached levels of community transmission where we can open businesses up fully, open schools up fully, and return to what people would consider normal community activities.
I do not think that this is the time to rescind the mask mandate for the city of Omaha. This is the time actually to expand that mandate throughout the state.
The doctors are urging the community and leaders to do what has been proven to prevent the spread of COVID. Wear a mask, practice social distancing, and stay home if you're ill or have come into contact with someone who has tested positive. They say regardless of which side of the political aisle you fall on, it's time to face the facts that COVID-19 is on the rise once again in Nebraska.
COVID-19 is not a political or ideological issue. Our advice is the same regardless of political leadership at any level.
Reporting in Omaha, Jessica Edson, 3 News Now.
Food banks have seen an uptick in demand since March. The pandemic has increased food insecurity all over, including right here in Nebraska.
All across the food bank's 93 county service area, food insecurity has risen from approximately 207,000 to nearly 300,000 individuals. So the need is greater than ever.
And that may mean longer lines at food pantries, which is what one caller complained about to the police Tuesday morning. A local police scanner account tweeted out that an anonymous caller to 911 is upset because the food bank line is creating a hazard, and this is an ongoing issue. So the public decided to do something about it.
The food bank received more than $2,000 in donations that were tied back to the Omaha Scanner tweet.
People responded to the tweet with screenshots of their donations to the food bank for the Heartland. The kicker is that their location was not the one causing this, quote, hazard, but it was a pantry that they directly work with.
It may have pertained to one of our many pantry partners across the Omaha Metro, and they have done an outstanding job, during this crisis, helping to get, food to the increased number of families who are in need.
The food bank says they will use these donations to continue feeding those that are struggling with the pandemic, and also say they are completely overjoyed with the outpouring of support. Reporting in Omaha, Ruth Olsenaida, 3 News Now.
Drugs like meth and fentanyl are a real problem here in Omaha. According to the DEA, seizures are up, and most of it comes to the Midwest from Mexico. 3 News Now investigative reporter Jeff Van Sant has the story.
In the early 1990s and early 2000s, meth was king here in the Midwest, especially in small farming communities where needed chemicals were easy to come by. But then production moved to Mexico after a massive crackdown by authorities here in the U.S. The result, cheaper and more potent meth on our streets.
Omaha 18 from pad 6 for your runway 36, making bay departure 13015, good to take
3 News Now has taken you on a journey to the southwest border with Mexico. Looking at the drug war, the fight against smugglers bringing in untold amounts of meth, cocaine, marijuana to our streets.
We're talking tens of thousands of people who are dying every year from cartel violence. If that's not a war, I don't know what is.
That war is raging across the United States.
Get out in the hallway right now!
And right here in Omaha, like so many other cities, drugs have their victims.
It's a nightmare. Because, you're fine 1 second, and then next thing you know, you lose everything. Like, I've burnt so many bridges with my family and, my friends.
Tyler got addicted to cocaine.
The first time I took it, it was, I got sick. And then, I wanted that rush, And so I just kept doing it and doing it and doing it.
His entire life has been affected by drugs. He suffers from cerebral palsy and scoliosis. His mother was a drug addict.
When I was younger, like in my early teens, I was always in that why me aspect. Like, what did I do to deserve this?
Because we used to get them from Pettit's Pastry a lot when I was a kid.
He lives at Open Door Mission, trying to turn his life around, just like his friend Joshua. He's originally from California. He started out on prescription pills, then moved to heroin.
At first, it was bliss. It was a good thing, because it was cheaper than pills, and it kept me going on an everyday basis. But within such a short period of time, I lost everything. Lost all my friends, my family, lost my sense of credibility. Just everything.
His addiction is what brought him here to the Midwest. He got caught trying to smuggle meth from California into this area.
Selling drugs to get by, just to sport a habit. Never really made much off it other than just enough drugs to get high and get the next batch.
Drugs like meth have been around since the 90s. Small communities in Nebraska like Beatrice were hit hard.
One of the things we were seeing was high school kids, young adults who otherwise hadn't been in the drug world would suddenly experimenting with meth and getting methamphetamines and getting addicted.
Small communities like Beatrice were perfect breeding grounds for meth labs.
Back in the late 90s, early 2000s, domestic production of methamphetamine was a huge problem, especially here in the Midwest. You have all the farming communities.
One of the things we found was it was everywhere. And we literally could put out as many investigators as we could afford and buy as much meth from drug dealers as we could, because it was everywhere.
Beatrice Police Chief Bruce Lang led the fight against meth in his town. Eventually, drug enforcement got tougher across the U.S. Production tapered off in the 2000s, but not without consequences.
The Midwest was dealing with 7,000 to 8,000 small toxic labs a year, to now the mega labs that are going down in Mexico that are producing thousands of kilos, developing a higher, purer, more potent product than any domestic lab here could have ever fathomed producing. I have 453 dosage units out of this right here.
Stopping the flow is never ending.
You kind of put it in perspective. Last year we seized, just the DEA here in Omaha seized 250 pounds of meth, which is a lot of methamphetamine for this region. Years prior, we seized 80 pounds. If you look at the geography of, let's say, Omaha, you have I-29 running north and south, and I-80 running, major pipeline running east and west. Omaha sits right at the crosshairs of those two interstates.
On any given day, Interstate 80 here is a pipeline for criminal activity. We've seen 20-year-old college students that are trying to make a little extra cash. We've also seen the 75-year-old retired couple that they're very good at it because they're not the type that you would suspect of being involved in that type of thing.
While the drug war rages, so does the fight to help addicts. That brings us back to Tyler.
If I don't have something to do, I'll go nuts.
And Joshua.
The little brother I never wanted.
That's my bodyguard.
They're trying to return to normal life, helped by those around them at Open Door Mission.
I'm pretty positive that I'm going to be able to stay with it this time. I mean, for me, like I've been wanting to get clean for 3 or 4 years now, you know, if not longer. It's just the sickness, it's getting over that. And, you know, now that I'm over it, it's time to just, you know, stick with it, stay clean.
I have the greatest group of friends, and you know, I'm so glad I'm here. I've actually decided to stay here because they have apartments upstairs you can rent, so I've decided to stay here and, you know, continue to use the support system that I've built up.
Two guys who are survivors. They're reconnecting with family and friends, rebuilding their lives. As for the drug war, it's never ending. Law enforcement are doing their part, but say continued education in our schools or parents teaching their kids about the dangers of drugs are great tools in the arsenal. But at the end of the day, the United States has a nasty habit, an insatiable appetite for drugs.
The only way we win this is we got to have people stop wanting it.
According to the CDC, since 1999, more than 750,000 people have died from a drug overdose. Jeff Van Sant, 3 News Now.
Stay connected at 3newsnow.com.